Imagine waking up one morning and noticing that your vision in one eye looks blurry, washed out, or like someone smeared a foggy lens across it. No pain, no warning, just a quiet, sudden change. You might assume you slept on it wrong, or that your glasses simply need an update. But what if the problem is happening deep inside your eye, in one of the most critical blood vessels in your entire visual system? That is exactly what central retinal vein occlusion is, and in this video we are going to cover what symptoms to watch for, what causes it, how doctors diagnose it, and what treatments are available. Let us get into it. So what does central retinal vein occlusion actually feel like? In most cases, people experience a sudden, painless loss of vision in one eye. It can range from mild blurriness to a dramatic drop in vision quality. Some people describe it as looking through a foggy window that will not clear. Others notice a dark shadow covering part of their sight. Because the condition is completely painless, many people delay seeking help, which can seriously affect their outcome. Now, what actually causes this? Think of your eye like a city and the blood vessels as roads. The central retinal vein is the main highway carrying blood away from the retina, the light-sensitive layer lining the back of your eye. When that highway gets blocked, usually by a blood clot, everything backs up. Pressure builds, blood leaks into the retina, and the delicate cells responsible for your vision begin to suffer. The most common risk factors are high blood pressure, diabetes, high cholesterol, and glaucoma. Age is also a major factor, as this condition is far more common in people over 50. Anything that harms your cardiovascular health can also harm the tiny vessels inside your eyes. How do doctors confirm a diagnosis? It starts with a comprehensive eye exam. Your doctor uses special eye drops to dilate your pupils, meaning temporarily widening them, to get a clear view of the back of your eye. What they look for is a very distinctive pattern. The veins across the entire retina appear swollen and twisted, with flame-shaped areas of bleeding scattered throughout, almost like a storm swept through the inside of your eye. Doctors often follow up with a test called OCT, which stands for optical coherence tomography, essentially a high-definition scanner that produces detailed images of the retina. A fluorescein angiography may also be used, where a harmless dye is injected into a vein in your arm to map the retinal blood vessels and locate the exact blockage. Can central retinal vein occlusion be treated? There is currently no way to reverse the original blockage once it has occurred, but its complications can absolutely be managed. The main complication doctors focus on is macular edema, which is swelling in the central part of the retina called the macula. Think of the macula as the high-definition lens of your eye. When it swells, your central vision becomes blurry and distorted. The first-line treatment is anti-VEGF injections, small injections delivered directly into the eye that block a protein-driving swelling and abnormal blood vessel growth. Medications like Eylea and Lucentis are commonly used for this in the United States. A corticosteroid implant called Ozurdex is another option, releasing medication slowly inside the eye over several months. Laser therapy may also be used in certain cases to prevent a complication called neovascular glaucoma. And perhaps most importantly, controlling blood pressure, blood sugar, and cholesterol is essential because unmanaged systemic conditions can make outcomes significantly worse. If you found this video helpful, please hit the like button and subscribe to our channel so you never miss a new eye health video.